On January 2nd, Dr. Theresa Tam convened a meeting of her provincial counterparts to talk about worrisome news coming out of China. Weeks later, we gathered the incident response group at the cabinet level to talk about this development, and we continued to engage with scientists and doctors from around the world, including at the WHO, including our own internal capacities, to prepare and respond to this pandemic. We've learned many things since then, Mr. Speaker, and we'll be better positioned in the future. But as it is, we will continue to do everything we can, as we have, to protect Canadians.
The Honourable Leader of the Opposition.
Mr. Speaker, the Public Safety Minister told committee he wasn't aware of anyone asking to close the border until days before they closed it. The Prime Minister just confirmed he was warned on January 2nd by Dr. Tam, and we now know that in February, officials at Public Safety were sending notes to government departments warning about the transmission risk of Canadians returning from abroad. Why did the Prime Minister ignore warnings from his own public safety officials for over a month before he closed the border?
Every single step of the way, we leaned on experts and epidemiologists and international health experts in the pandemic for the best recommendations on how to keep Canadians safe. We moved forward on those, including setting up quarantine facilities for Canadians returning, bringing in extra measures at the borders, and we were able to see in those early days a very low incidence of cases in Canada. Now, there are many things we're going to be looking back on and say, oh, we should have done this differently, should have done that differently. But I can tell you, every effort was made to do everything right, and Canadians are benefiting from those decisions.
She refused to answer when asked if Canadians should listen to the federal, provincial, or municipal health authorities when there's conflicting advice about lockdowns or mask wearing. In fact, on those issues, she's changed her own mind several times, Mr. Speaker. Why can't Canadians get a straight answer from the federal health minister when it comes to public health advice about COVID-19?
We have been clear from the very beginning that the need to do everything we can to keep ourselves and others safe is what Canadians should be doing. I'm very pleased to support Dr. Tam, support the Health Minister, support all of our various health experts across the country who are putting forward measures that Canadians can take on to keep themselves safe. I'm extremely pleased to hear the member opposite, the Leader of the Opposition, talk about the importance of wearing masks. It's important that everyone wears masks.